Hello, Sam and Lorraine here, and today we'll be presenting the pamphlet that we made that features the importance of a multidisciplinary approach in dentistry. We figured what better way to highlight the multidisciplinary approach than to straight up show an actual case published in 1994. Pretty old, but still relevant, I might say. This approach is still most likely used today because it puts importance on saving natural teeth. Teeth that would have been routinely extracted but was thus saved and restored through collaboration. Hold on. Let's get to it. The case is of a 10-year-old boy who came to the dental clinic 20 hours after a fall that injured his anterior teeth. Clinical examinations showed lacerations of the upper lip with moderate edema, a transverse crown fracture on the maxillary left central incisor, and even more fractures on the maxillary right central incisor and left lateral incisor. Doesn't look good. Radiographs were taken and then analyzed as one ought to do, and it showed that the apices of the central incisors were nearly completely formed, and it also verified the presence of the fracture of the maxillary left central incisor, so confirmed there are fractures. So this case is already shaping up to be a tough one, but thankfully this is nothing a little endo, ortho, and prosto can't fix. Right? So after the clinical examination and then the radiographs, the endodontist, the orthodontist, and the prosthodontist had a little meeting, and then they figured out a treatment plan together. A diagnosis and then the treatment plan. So it went like this. The endodontist would first address the root canal system because that's a little compromised now. Address the root canal system, post-incur usual endo procedure, and once that's done, the orthodontist would come in, would align the tooth to reduce the risk of future fractures as well as improving the overall function of the patient's bite para makakaon ng pasyente. Okay, great. And then the prosthodontist would come in and restore the tooth function and appearance because there is essentially a missing crown there, as seen in these pictures. Utilizing your expertise in designing and fabricating to achieve aesthetic harmony, because you don't want the patient to walk out of the clinic with a missing tooth. They're there to be fixed. But this is of course not going to happen all in one day, especially in 1994, I'm pretty sure. So this process is summarized through photographs and captions as seen here, sort of like a little step-by-step picture book, as well as the collaborative process, as you can see here, that the endodontist, orthodontist, and prosthodontist applied for their treatment plan, or at least most likely applied for their treatment plan. You know what I mean? Long-term results are a major highlight to this case, as the patient was documented 2 years after the treatment was finished, and hey, he's still looking pretty good. It's very nice work. That's a lot of effort for a few broken teeth, right? But it's pretty worth it because hey, there are benefits to preserving natural teeth. And what are these benefits?
The benefits of this treatment includes the preservation of natural tooth. By treating the fracture and restoring the tooth, the patient can avoid the need for extraction and preserve their natural tooth, which can be a significant advantage in terms of function, aesthetics, and long-term oral health. A restored oral tooth can help restore chewing function and improve the patient's ability to speak and smile. It also enhances aesthetics. A well-crafted restoration can blend seamlessly with the surrounding teeth, restoring the patient's smile and confidence. It can also reduce the risk of complications. Treating the fracture and restoring the tooth can help prevent future complications, such as infections, abscess formation, or tooth loss. And lastly, it leads to long-term oral health. By preserving the natural tooth and addressing the fracture, the patient can maintain good oral health and reduce the risk of future dental problems.
And that wraps up our presentation. Thank you. Collaboration.